to address the question. I'm Dr. Larry Burchett, coming to you from the front lines of the ER in this coronavirus thing. I'm going into work shortly. Who should get tested and who should not get tested? Biggest questions that I'm seeing now in patients, I worked yesterday in the ER, is who needs a test and who doesn't need a test. I'm going to give you some kind of broad principles. Every case is different. I think if you're already staying home and you get a mild case of cough and fever and whatever, and you're not planning to go anywhere and expose anybody else in the next couple of weeks, I don't think you need to get a test to know. So I think that's one group of people, young, healthy, get a little sick, already staying at home isolating. I don't think you need to get a test because it's not going to change anything. The second principle is, how available is the test? There's still a lot of places in the country where in order to get a test, you have to call public health and get approval. You have to fit certain criteria of being exposed or travel history to China or Washington or someplace where they've got it. And the test is not readily available, urgent care style, for everybody. So those people in that setting, I don't know that a technology where maybe it'll be able to be turned around within a day, that's not available yet at most places. And it's supposed to take 2 or 3 days, but I've had friends, other doctors, where it's taking 4, 5, 6 days a week to even get the result. So what are you doing in the meantime? So the test is not very practical in a lot of cases. Now, who should get the test? Because I've had some patients come in and we've worked through this together and we've been like, you know what, you really do need to get the test. I had a guy, had some mild symptoms, cough, so forth, worked in a prison where he could have been exposed. And then also he's going to go back there. Should he go back to work? You know, knowing if he's positive or negative is helpful, because if he's negative, then I can say, yes, you can go back to work and feel okay that at least right now you don't have it. If he's positive, then we can also know for sure, no, you shouldn't go back to work. So I think, you know, if you're working in an environment where you could potentially spread it to other people, if you had it, I think that's reasonable to get a test. If you live with or caring for older people, people with medical conditions, where them getting it could be I don't think a test is probably necessary unless you get sick or have some sign of complications. I'm going to check in here with this thing and see. It's a bunch of, hey, Jack Clark. Hi, Raquel. Hi, Kathleen. What's up, D-Lo? Hey, Josh. How's the front lines in Medicland? Jay Johnson, what's up, my man? Tyler got tested yesterday, put on home isolation. There's another implication. So, Tyler, as a nurse, you get Martha. Hey, Amalia. Hello, Jennifer. Thank you. I'm about to head into work in a couple minutes. Hi, Danelle. Rakeem, Tyler. Just ask my people that are admitted to the hospital and sick want to get tested. But what I'm seeing is there is some corona in this hospital in Central Valley that I'm working at, but can't forget that at the same time, people still come in with normal ER complaints like abdominal pain and heart failure and strokes. Sometimes it can be very difficult to tease out, is this smoker's lung from COPD that just got bad? Is this heart failure because the patient isn't taking their heart failure medications? Or is there shortness of breath and cough? Is that coronavirus? It can be very difficult to separate that stuff. And so as a doctor in the ER, you know, I'm working through these things kind of in real time with my bias, like I'm looking for corona in everybody, and it's not what's out there, right? Most of what's coming in is the regular stuff that comes into the ER every day, and is not, you know, this virus that's on our brains because of the media. Jack Clark, stay safe. I moved my office home. Get food and booze for weeks. Good luck to you, my brother. Get food, maybe lay off the booze. But yeah, dig in. You're right. I'm worried about the jails. You know, I think about jails, homeless shelters, nursing homes, all of these things which are such high risk for this thing to propagate around. For people that work in those scenarios, yes, getting a test I think is very reasonable and responsible so that you don't spread it, because in those places it spreads like wildfire. I could take a couple questions and then I need to run for work. But I hope that helps in terms of, should you get tested? Should you not get tested? Is it okay not to get tested? Yeah, absolutely. If you're young, healthy, if you're doing okay, it's fine to just stay at home. Because again, some people, you show symptoms by day 5, 6, you get tested day 7, you don't get your result till day 14. Guess what? You just went through the illness. You know you're positive, but then you're through the whole thing. So I don't know how helpful to the individual testing is in some cases, although the doctor, the epidemiologist in me, the public health guy, wants to know where this stuff is for sure. Hey, Raquel. Yeah, I want everybody to be safe. And thanks to everybody who's doing their job in this thing, from the folks that are working at grocery stores to the nurses and docs in the ER. I'm going to sign off. I got to get to work, but I wanted to check in for a second. This is just what I'm seeing and kind of how